gynecology. We're going to study also a little bit of obstetrics. And we are going to mention that other than a textbook, also journals, articles help learning in how to apply informations, different kinds of informations because the specific situations at hospitals and clinics. This way, reviewing it will be able to retain information, and by organizing facts to be able to recall and make all the data applicable to a specific patient. By working these things out will provide a way to make this process easy. We have mentioned before, right, the first thing is to gather the information, right, which is the establishing of database, which is taking the history of patient, performing the required physical examinations, obtaining laboratory examinations, right, the ones who were selected for special evaluations. It can be included urodynamic testings, imaging testings, etc., etc. The historical examination becomes one of the most important parts and useful in the patient's record, and especially without detaching the sensitivity and respect, right, which has to be applied and exercised during the interviews with each one of the patients. We're going to say that and make emphasis, right, and that history, the history of the patient, the history of their illness, vaccines, medications, testings, is the most important tools in order to find a pre-diagnosis or diagnosis in order to make an assessment. And the art of looking for this kind of information in an environment of non-judgmental, right, and to be sensitive towards the patient, respectful at all times, because things happen that we will see in many histories and illness in patients that really sometimes the illnesses where they appear for not reason, especially now that the studies on genetics have brought all kinds of information which have provided a treasure of findings, right? And for this matter, right, it is very important, especially in gynecology, um, to be very respectful, very sensitive, non-judgmental at any times of whatever happened to the patient, or what is going on, because things happen not for no reason, but because they are genetically inclined to develop certain illnesses, or because they were obtained by contagious agents, which target specific areas, which sometimes it looks like it cannot be, but eventually is the way it is. Starting right with the history of the patient, right? The basic information, right? The first thing, the age must be recorded, because some conditions are usually more common at certain ages. For instance, pregnant women younger than 15 years or older than probably 37 years can be of a greater risk for preterm labor, preeclampsias, or miscarriages. The gravidity is very important to record number of pregnancies, including current pregnancies, including miscarriages, ectopic pregnancies, and stillbirths. The parity number of pregnancies that have ended at gestational age greater than 20 weeks, right? Abortuses, number of pregnancies that have ended at gestational ages less than 20 weeks, includes ectopic pregnancies, induced abortions, and spontaneous abortions. The last menstrual period, right, which states by capital L, capital M, capital P. The first day of the last menstrual period. We said that we're gonna mention the obstetrics, right, a little bit. And in obstetric patients, somehow the LMP is important in determining the gestational age. And this is the capital E, capital G, capital A, and it's calculated from the LMP, right? The last menstrual period, like we say, stands for, or by ultrasound, right? And therefore, calculating the expected due date, which is we're going to write it as a capital E, capital D, is to subtract 3 months from the LMP, and eventually add 7 days to the first day of the LMP, right? Therefore, moving on with recording all this information, another thing that it has to be written very clear is the chief complaint, right? What is the main reason the patient seeks assistance from the clinicians, right? And the question is, what is that brought the patient into the doctor's office? It is a scheduled appointment, right, or not? If it is just a symptom, non-expected, right? It could have been just abdominal pain or vaginal bleeding in pregnancy, right? And the duration and character of that complaint, right? It's also very important to write associated symptoms which are making it worse, right? As well as relieving factors, right, have to be written. The complaint, right, will provide a path to make a diagnosis, and the reason or possibly etiologies should be explored by keeping the inquiries, right? You can probably ask, right, if the complaint is postmenopausal bleeding, right? Probably could be endometrial cancer, right? Probably, right? And these questions could be related to the risk factor for endometrial cancer, and the hypertension will provide a way to find out where this chief complaint is going to. Also, to ask if the patient has diabetes, right? Anovulation, early age for menarche, late age of menopause, taking consideration the weight, right? The conditions of infertility or probably nulliparity, and therefore, right? It is also very important to write the menstrual history, right? The age of menarche, right? And it says so in your book that normally be older than 9 years and probably younger than 15, 16 years, right? And the cycles, right? How it behave this menstrual period. From the first day of one menses, right, to the first day of the next menses. If it's the normal 28 days plus or less 7 days, in between 7 days, but in, but also and always 28 days after 28 days from the starting of the period. Or if it's just 21 after 21 days, right? And it can be taken in consideration 35 days also, right? And the quantity of menses, the menstrual flow, right, should be last less than 7 days, or for how long it lasts, right? The menstrual cycle. Like how much it is, or less than 80 milliliters in total volume, or probably it's 50, or right, if it's abundant or mild or very little, right? If a menstrual flow is excessive, the menstrual period is called menorrhagia, right? And irregular and heavy menses is called metrorrhagia. It is also very important to write the contraceptive history, the duration, the kind, the last time the patient used the contraceptions, and if they have felt any side effects, right? It has to be written the sexually transmitted diseases, right? If it's positive or negative for herpes, simplex virus, syphilis, gonorrhea, chlamydia. Also, if it's affected by the human immunodeficiency virus, right, called an HIV, right. Has to mention pelvic inflammatory diseases or human papilloma virus, um, number of sexual partners, whether if recent change in partners, and which kind of contraceptions barriers, right, they use in order to treat this, right, this way of living, right. And we are going to be writing the date and gestational age of each pregnancy at termination and the outcome. If induced abortion, then gestational age and methods. If delivered, then whether delivery was vaginal or cesarean. If it's cesarean, it was a low transverse versus classical, and all complications of pregnancy should be listed. It has to be written the past history, the medical history, illnesses, if they had hepatitis, if they have diabetes mellitus, if they have a heart disease, hypertension, cancer, if they have a thyroid diseases, pulmonary diseases, and it has to be explained. It has to be said the duration, the severity, and the therapist, right, should be written, have to be included. Also, any hospitalization should be listed for reasons, and the reasons for admission in hospitals, which kind of interventions, and locations of hospitals. Also, the past surgeries, right? History, year and type of surgeries, right? Any complications the surgery has brought through their gynecological conditions, type of incisions, such as laparotomy versus laparoscopies, right? The allergies, reactions to medication should be written. If they eventually have some sort of complications in between medications and the relationship and for how long it lasted, right? If they are hypersensitive to any, and should be distinguished from an adverse reaction, right? The medication, it has to be written, a list of medications, dosage, routes of administration, and frequency. Durations and use should be obtained. Prescriptions, also over-the-counter herbal remedies, are very important to write. Also, if they use any illicit drugs, including tobacco or alcohol, should be recorded. And how to review, right? A way to review, right? In the gynecology, right? A system or review should be performed, focusing on the more common diseases. For example, in pregnant women, the presence of symptoms referable to preeclampsia should be cleared. Headaches, visual disturbances, facial swelling, epigastric pain. For example, in the women and the elderly, the symptoms that are suggestive to consider is the cardiac diseases and chest pains, fatigues, weakness, shortness of breath, palpitations, right? During the physical examination, right, which it has to be written and it has to be performed as follows, right? The general appearance, right? Well nourished, right, will versus cachectic, right? Anxious will be versus calm, and obtunded will versus alert. The vital signs, the blood pressure, the temperature, the respiratory rate, the heart rate, the height and weight have to be written. The neck examination and the head, right? Look for evidence of traumas, tumors, facial edemas, goiter, and carotid roots should be sought. Probably cervical and supraclavicular nodes should be palpated. On the breast examinations, inspection for symmetry, right? Retraction of skin or nipple with the patient's hands and or hips to accentuate the pectoral muscles, right? And with arms raised. When the patient is supine, the breast should then be palpated systematically to assess for masses. In regards on nipples, should be assessed for some sort of discharge, right? And following the axillary and supraclavicular regions should be examined for adenopathy, right? The cardiac examination, right? Talking about the point of maximal impulse, which is written as capital P, capital M, capital I, should be ascertained. The heart auscultated at the apex of the heart as well as base. Heart sounds, murmurs, and clicks should be characterized. Systolic flow murmurs are fairly common in pregnant women due to the increased cardiac output, but significant diastolic murmurs are unusual. The pulmonary examinations, lungs should examined thoroughly and be looking for wheezes, rales, bronchi, and bronchial breath sounds should be recorded. The abdominal examination, the abdominal, in regards of the abdomen, should be inspected for scars, masses, or organomegaly, distensions, whether caused by the spleen or liver, also discolorations, auscultation of bowel sound should be accomplished to identify normal versus high-pitched and hyperactive versus hypoactive sounds. During percussion in the abdomen, looking for presence of shifting dullness, and by palpating, carefully look away from the area of pain, which involves one hand on top of the other to assess for masses, tenderness, and peritoneal signs. All the tenderness should be recorded on a scale, whether if it's from 1 to 4 or 1 to 10, or by following phases, right? Where the 4 or the 10th is the most severe pain. And by asking and finding out if this pain is involuntary or voluntary movement, and therefore it should be noted, right? It should be noted, clearly noted. The examination of the spine and the back, it should be assessed for symmetry, tenderness, or masses by the flank regions. Assess for pain on percussion signs. Probably that will indicate renal disease, especially on the flank regions. The pelvic examination, the preparation, to be prepared and to have the instruments prepared for adequate pelvic examination is a very important, is crucial, including counseling and everything from it is what is expect. You can be sure that you will receive and you will find what you really expect, right? You must practice the pelvic examination with adequate lubrication and sensitivity to pain and discomfort in those perineal areas in the patient. The genitalia externally should be observed for masses or lesions, discolorations, tenderness, swollen, or tenderness. My ulcers in this area indicate herpes simplex virus, vulvar carcinoma or syphilis, vulvar mass, right? Probably Bartholin gland cyst or abscess. Pigmented lesions might require biopsy since malignant melanoma is not uncommon in the vulvar region. Speculum examination must be performed. The vagina should be inspected for lesions, discharge, estrogen effect, well rucated versus atrophic, and presence of a cystole or a rectocele. The appearance of the cervix should be described, and masses, vesicles, and probably some other lesions should be written. Um, by manual examinations, initially the index and middle finger of the one gloved hand should be inserted into the patient's vagina underneath the cervix, while the clinician's and other hand is placed on the abdomen of the uterine fundus. With the uterus dropped between the two hands, the examiner should identify whether there is cervical motion tenderness and evaluate the size, shape, and directional axis of the uterus, and should be assessed with the vaginal hand and the lateral vaginal fornices. The normal ovary is approximately the size of a walnut. Take a look in your book, right? The size of the ovaries, right, which is shown, right? And also during the rectal examination, it is important to write down if it reveals masses in the posterior pelvis and to be able to identify occult blood in the stool. Tenderness, nodularity in the uterosacral ligament can be signs of endometriosis. The posterior uterus and palpable masses in the cul-de-sac can be identified by rectal examination. And also, it is important to write the condition of extremities and skin, the presence of joint effusions, tenderness, skin edema, and cyanosis. It has to be recorded. The neurologic examinations of patients sometimes, or the ones who present neurological complaints, require an assessment including cranial nerves, strength, sensations, and reflexes. Following these examinations, we present the laboratory assessments, right, for patients, right. In this case, following the obstetric patients, we present the prenatal laboratory test, which includes the CBC or blood count, a total complete blood count. And this is to assess for anemia and thrombocytopenia. We also have this write the blood type, the RH, and antibody screen is of important for all pregnant women. All these women who are RH negative, Rogaine administered at 28 weeks gestation and at delivery if the baby proves RH positive to prevent isoimmunization. The hepatitis B surface antigen indicates patient is infectious. At birth, the newborn should be given hepatitis B immunoglobulin, right, and hepatitis B vaccine in an attempt to prevent neonatal hepatitis. Rubella titter. If the patient is not immune to rubella, she should be vaccinated immediately postpartum because it is a live attenuated vaccine. This immunization is not given during pregnancy. The syphilis non-treponemal test. A positive test requires confirmation with a troponin test, right? Treatments during pregnancy is crucial to prevent congenital syphilis. Penicillin is the agent of choice. Pregnant women who are allergic to penicillin usually undergo desensitization and receive penicillin. The human immunodeficiency virus testing, the screening test for this is called ELISA. And when it's positive, we'll has to have the Western blot or other confirmation testings. The urine culture or urinalysis in order to find asymptomatic bacteriuria, which complicates the 6% to 8% of pregnancies, right? The pap smear in order to find for cervical dysplasia or cervical cancer involves both ectocervical component and endocervical sampling. Some clinicians prefer liquid-based media for better cellular sampling for HPV subtyping. The endocervical assays for gonorrhea and or chlamydia trachomatis for high-risk patients. Timing prenatal testings. The serum screening for neural tube defects or Down syndrome offer usually performed between 16 to 20 weeks gestation. The screening for gestational diabetes at 26 to 28 weeks generally consists of a 50 grams oral glucose load and assessment of the serum glucose level after 1 hour. Some clinicians used to repeat the complete blood count, cervical culture, syphilis serology in the third trimester. The culture strategy for group B streptococcus is probably adopted. Then introital cultures are obtained at 35 to 37 weeks of gestation. Take a look. Take a look at your book by this level and how the pap smear with ectocervical and endocervical components, right, is applied, right, and how it is taken, right, right, in order to be fixated in the slide to be observed, right. When the doctor offers this in vitro examination, and it is very interesting and it's very important to get to know, right, all these things, just to be sure that the person has what the assessment probably could be what is been looking into, and write it down, all the steps and everything you perform in their history, right? In the laboratory tests for gynecological patients, it depends on age, the presence of coexistent disease, or just a chief complaint. Probably the most common scenarios: threatened abortion, quantitative age, CG, and or progesterone levels might help to establish the viability of a pregnancy and a risk of ectopic pregnancy. Amenorrhea due to uterine fibroids, CBC, endometrial biopsy, and pap smear. The endometrial biopsy is performed to assess for endometrial cancer, and the pap smear for cervical dysplasia or cancer. And a woman 55 years or older with an adnexal mass is capital C, capital A dash 125, and capital C, capital E, capital A tumor markers for epithelial ovarian tumors. Right. Some of the imaging procedures should be written, such as some of the testings, right? The ultrasound examinations, right? In this case, when it talks to obstetric patients, says that ultrasounds is the most commonly used. This procedure in pregnant women to establish the viability of the pregnancy, the number of fetuses, the location of the placenta, to establish the gestational age of the pregnancy. And right, the gynecologic patients discusses the adnexal masses is evaluated by sonography, assessing for size and echogenic texture, simple fluid filled versus complex fluid, and solid components versus solid. The uterus might have presence of masses such as fibroids in the utero, and the endometrial stripe can be measured. In postmenopausal women, thickened endometrial stripe might show malignancy. Fluids in the cul-de-sac indicates ascites, and therefore an gynecologic ultrasound will usually show, including investigation of whatever happened with the kidneys, because hydronephrosis might suggest a pelvic processes, which is the urethral obstruction. Also, it has to be written computer tomography if it was provided or given, right? Because of the radiation concerns, these procedures in pregnant women are not performed unless sonography is not helpful, or as the last resource is really required. The CT scan is useful in women with post-low abdominal and pelvic masses, right? Probably help to find lymph nodes and retroperitoneal disorders. Magnetic resonance, right? MRIs will be able to identify with this testing soft tissue planes, defining Mullerian defects, a vaginal agenesis in uterine Edelphys, which sometimes is a condition of double uterus and double cervix. In this case, by in the findings of uterine fibroids, and it's helpful establishing locations of pregnancies, differentiating a normal pregnancy from a cervical pregnancies. The intravenous pielogram is used to assess concentration, ability of kidneys, patency of ureters, and the integrity of the bladder. Used for detecting hydronephrosis, urethral stones, urethral obstructions. The hysterosalpingogram A small amount of radiopaque dye is introduced throughout the cervical cannula and radiographs are taken, useful for detection of uterine abnormalities, submucous fibroids, and uterine adhesions, patency of the fallopian tubes, tubal obstruction, or hydrosalpinx. 1, 2, 3.